Glad you've joined us with our practice today. I'm going to be going through your mouth, and we're going to take a full mouth series of x-rays first, and then I'm going to sit down right now since we've already done the x-rays. We're going to look at your gums and see how healthy they are at this point in your life. What we're looking for is 3 millimeters. 1 to 3 millimeters is healthy. It's a natural little moat around each tooth. Depending on the deepness of that, with this probe, and I'll show you the probe in a moment, will give me some indication of the health of your mouth. So let me show you the probe and what we're looking at here. So here's your tooth. This is the part of the tooth that you see in your mouth when you smile. And this is the bone underneath. Okay, this is normal healthy bone, this is normal healthy tissue. This little space right here is what we measure, where this tissue attaches to the tooth. This is the root and the top of the gum tissue. What we want to see is between 1 and 3 millimeters. Okay, when we look at this probe, that goes from 0 to 3 millimeters, and then 3 to 6, 6 to 9, 9 to 12. In periodontal disease, that's one of the things we check for, the toxins of the bacteria that live underneath the gum with everybody can congregate underneath here, and if they're here long enough and untreated, it will start releasing, they'll start releasing toxins that actually dissolve this bone and causes inflammation and bleeding with this gum tissue. Okay? Do you have any questions?
No.